Hey everyone, Dr. R here. In this video, we're going to talk about aneurysms and intracranial hemorrhage, and we're really building on the last video where we started to talk a little bit about different kinds of strokes. We talked about hemorrhagic strokes, so we'll talk about those, but first we'll start off with the circle of Willis and just go through some anatomy. This is particularly high yield that you know if you see a diagram of the circle of Willis that you know which arteries are where, okay? It's very important that you understand that, and we'll go through an angiogram together to kind of bring this home because they're testing more on the imaging now. So I'll show you what I mean by that, and then we'll talk a little bit about the aneurysms that can rupture, that can eventually lead to some of these different forms of hemorrhage. Now, in the last video, I told you a little bit about ischemic strokes. So we primarily focused on that aspect. So in this video, we're going to focus more on the hemorrhagic variants of that. One thing I want to say is that intracranial, when I say intracranial hemorrhage, that's a very broad term. A lot of these can fit into the intracranial hemorrhage category, okay? But when I say intraparenchymal or intracerebral, I'm talking more about bleeding directly into the brain, not into the ventricles, not into the arachnoid space, not between the different layers of the arachnoid or dura mater. I'm talking about bleeding directly into the brain, parenchyma, like the name says. So intraparenchymal or intracerebral, talking more about lobar and lacunar hemorrhages, whereas if I say intracranial, I'm using a more broad, non-specific term. Okay, so just kind of keep that in mind.